Welcome to another socially distant edition of the Who the Folk podcast, sponsored by Gold Group Realty. I'm Lonnie Goldsmith, the editor of TCG Folk. This week we talked to Alisha Baines Simon, who works for the Minnesota Department of Health, about some of the COVID-19 modeling that she and her team have been a part of. We talk about what her pre-COVID job was at MDH, how the data she's compiling gets used, and what she's looking forward to in a post-shelter-in-place life on this week's Who the Folk podcast. Alisha Baines Simon, welcome to the Who the Folk podcast. Thanks for joining us.
Well, thank you for having me. It's fun to be here.
So you work at Minnesota Department of Health, which is obviously a department in the state that is in the spotlight for obvious reasons right now. And before we started recording, I asked what you did there, and it was sort of there was a pre-COVID answer and a post-COVID answer. So, which I didn't realize it was going to be so complicated a question, but that's how these things go these days, I guess. So what are you doing there now, and what, hopefully in short order, will you get to start doing again?
So what I am doing now is I work with a team of people, and we are really focusing on helping with the modeling efforts. You may have seen little curves that Governor Walz put up, and that's part of some modeling done by the state and the University of Minnesota. So we're working on that effort. And then we're also spending a lot of time focusing on what data is available from other states and countries to kind of understand where the state of Minnesota is, and then also understand kind of the disease in general, and support the agency in that way. I was going to say, if you want to, what I hope to get back to is,
yes.
In my regular life, I work in the health economics program, and my team is focused on health insurance coverage and health insurance markets, healthcare spending, and also provider markets. So I hope to get back to doing some of that work, but right now COVID is more important.
For sure. Is the modeling that the team, but again, from the U's Public Health School and from the MDH, the modeling that you're working on, how far of a departure is that from what the health economic team would do in a normal day-to-day piece of the job?
So in some ways, it's a huge departure. We do have epidemiologists on our team. We are not infectious disease epidemiologists. On the other hand, one of the things that we're really good at doing is we're really good at dealing with new data and data we don't know. And having the team we have in place at MDH has really made it possible for us to ask questions because we understand the underlying data and kind of kick the tires, so to speak, on each model iteration. We do have one person who actually has been involved in infectious disease modeling as well. So, and has worked with the team at the U before. So it actually works out really nicely. It's a very collaborative environment and a good team to have in place. And that I think we do a good job of asking questions before the model gets to its kind of public place.
What does it take for the model to get to its public place? Obviously, looking at between the two entities, between the state and the U that are working together on this, there's a lot of names on there, and I'm sure it goes through, I would imagine, layers of people before it becomes public. What's the process for putting something like that out?
Well, even putting a model like this together is a pretty crazy amount of data, because you need to put in data from what we know about Minnesota, and then also what we know about this virus, which changes on a pretty much daily basis. So for each iteration of the model, the team at the university spends a lot of time finding out what is new to know about the virus. We do the same thing on the MDH side, and we will kind of talk about assumptions and what we've seen out there. If people have seen different things, do we agree or disagree with what other data is out there? They'll do some comparisons to other models, and then there is an insane amount of programming that goes on, and that's totally on the university side. They are doing some really amazing work on that. And then we also need to figure out what are the different possible policy scenarios that that are going to get modeled. So we have a baseline scenario, but then we'll also have, this kind of stay-at-home order versus, a just social distancing order, and those decisions have to be made, and that kind of runs the gamut. Who makes those decisions? That is not just us.
But they're taking the information. Whoever ends up ultimately making this decision, and I suppose the buck stops with Governor Walz. He's taking the data that the modeling data that you and the team have put together, and that is sort of what helps shape his thinking, then, I'd imagine, right?
So he certainly takes it into account. The model is certainly one of many things that he takes into account.
Sure.
It's so I would probably want to talk to him about how he about how he does that. But the model really does help give him some data and put data from a whole bunch of sources together, so he has that available to him.
So when did your role at MDH start to shift from sort of the health economic team to sort of this all hands on deck with COVID?
It really started, I think we kind of got started right around March 11th, 12th, somewhere in that range. They knew we wanted to do some modeling, and we got drafted into doing the modeling because of our data expertise, and we started working on it and have kind of been doing that since. And as we've been doing that, we've been working now. I get to work on a syndromic surveillance, which is trying to kind of use a whole bunch of different data sources to monitor COVID throughout the state, not just the people who actually have it, but people who maybe don't necessarily have it. Doing a lot of comparisons across between Minnesota and other states to see how we're doing. So it's really been, I guess, about 5-6 weeks now.
Okay.
Yeah.
So how are we doing compared to other states?
That's a good question. I feel like one of the things we're doing really well is really using a kind of science data approach to this and trying to look at what the data is telling us. And I feel like we're really pulling in all the experts we need. A great example is even what happened yesterday with the testing, getting the private sector to all work together on this one issue, which is COVID testing. We need everybody to come together and make sure we can get the tests done that are needed, and that got pulled together. So I feel like overall Minnesota is doing well in the sense that our government is definitely, thinking about what needs to be done in the future and trying to make sure we have the healthcare capacity we need when we need it. And they have definitely been in that planning phase, pretty much since we got started. That has been their focus. So I feel like overall Minnesota is doing a really good job, but we're all connected. We're all states, connected by borders. It's really easy to pop over to Wisconsin or Iowa. So I think that's why it's good that we're starting to work with some of those other states as well as we hopefully get to the push to reopen. Don't know when that will happen.
I know. I think we'd all like to know, but unfortunately, that's not part of your modeling.
No, not even close. And the modeling is really just. I mean, it's really important to know the modeling is not, is not like it's not static. Numbers change, and it's just one tool in the toolbox. It really is. And it's just to help give a sense of what might happen when you have so many variables going into it.
So I'm not going to ask you to name names or anything, but I'd imagine, given what you do, you see what states are doing things well and what states maybe could improve that could maybe do things better.
I think that's some of it. Some of it is when things hit too.
Right.
And what testing states have in place. So a state that I would look at is like a state like California. They shut down really early, relatively speaking. And that has definitely helped them. They've kept a pretty low number of cases. And at first, it seemed like maybe they were shutting down too early. They seem to be doing pretty well. I think Minnesota overall has done fairly well. And then you have other states like Michigan that seem to kind of have a handle on it now, but there was a brief period of time where they didn't quite have a handle on it. And so it takes some time to get back. I think one of the
Right.
things that's just hard about this is the level of testing across the whole country. It's is just pretty low. And we don't know how many cases are out there. And the less testing you do, the less you know how many cases are out there. And the thing with this virus is nobody's ever had it before, so none of us really have the immunity.
Right.
So it's pretty easy for it to spread because there are so many people it could possibly spread to.
Which I think is what, as we're recording this, you mentioned Governor Walls's announcement, which was yesterday on Wednesday the 22nd, of the partnership with Mayo to do the widespread testing across the state. Because, like you say, until we know who has it, it's harder to know when we can reopen and get back to whatever normal looks like when this is done.
Exactly.
So I'm not sure any of us know.
No, I don't think we do, and it's a really historic time to be alive right now. When you think about it, these are
that it is.
We don't know what's going to happen next, and that makes it exciting, but also very stressful.
Oh, no question. And with your job, did you come into MDH? Were you a data person? Were you a health person? Like, I guess what was it that brought you to this position?
So my background is I have a master's in health services research from the School of Public Health at the University of Minnesota. And so health services research is really sort of studying the healthcare system, not necessarily studying diseases. So if somebody were to study a disease from a health services research perspective, they might be looking at not, is this cancer, what is this cancer treatment? How does it work? But how do people pick the treatments they get? How do they pay for it? Are certain treatments more expensive? There's lots of cost effectiveness analysis. All of those things kind of go into health services research. So that was my background. And I also did a lot of survey research. So what actually brought me to the Minnesota Department of Health was they do a survey every 2 years on health insurance coverage in the state. So I came to the Department of Health to help run that survey and kind of have grown into my current role from there, learned about all the other sources of data that we have. And now that's part of what my team does is still that survey. But that's how I ended up at MDH.
So you're a data person.
I am a data person. But the policy stuff is really interesting. And that's what's kind of cool about what I get to do now is that we get to use the data to help inform the policy. And that makes it really interesting. That it's not just analyzing the data, which is the fun part, but it's also that second step of interpreting it and helping other people understand it as well, so that they can use that then to do good healthcare policy.
So what is the data that you've seen so far telling you about COVID? Do you know yet in terms of, what we're looking at in terms of, best case, worst case in the state, or is it too soon to know, or are you not comfortable going there?
It's a really hard question.
Sure.
I'm not totally comfortable going there. Because,
that's fair.
Just because I really don't know. I mean, the biggest thing I know from all of this is, it's a long haul. That is my sense, that we're kind of in for a long haul. And the only reason for that is really, everybody is susceptible to this virus as of now, or pretty much everybody. So until we have a vaccine or some treatment for it, we have to be careful. And I just don't know how long that's going to take. And that is like way beyond me I'm not doing the vaccine research or anything like that. So that is
no.
And and we just don't know, because it's a new virus, we just don't know a lot about it too.
Right.
And I think that's been kind of the most interesting thing is, first it was kids don't get it. Then it was like, well, I think maybe they do get it. And well, maybe they don't get it. Oh, they're asymptomatic. They're still passing it along. So we're just learning new things every day. Something else will come out. And that's actually one of the really cool things about this is that we're all learning about it at the same time. And there's a lot of sharing going on. Even within, just the number of scientific articles that are just being released on an almost daily basis is pretty amazing.
So how challenging does it make your job, and by not just you individually, you as the team that's putting these models together, how big of a challenge does it become knowing that, every piece of data comes in could be another, monkey wrench into the works that makes it, not screws it up, but makes it more difficult for you to create something, predictable maybe.
Well, and I think that's the important thing about the models is, each time we go into the process of updating it, we refresh as much data as we can, but there's still lots of things that aren't known. So you kind of just take the best that's out there right now. And I think that makes it hard for people to understand it because it does keep changing. And it's supposed to change, but there's a part of you that just wants it to stay the same. And like that, the curve to just stay the same every time. And, we're going to flatten it, but but the time is going to be the same. And that, I think that's one of the hard things about it is that everything is fluid. And it makes our jobs harder too, because something that was interesting last week is no longer interesting this week. And so we're all, kind of running on all cylinders. I feel like this is pretty much everybody at the Department of Health right now, just running on all cylinders to make sure that we are staying on top of everything. And also just knowing that it's going to keep changing.
Gold Group Realty works with buyers and sellers of residential and commercial real estate, landlords with vacancies to fill, and tenants seeking a new home. They are a local, full-service real estate brokerage and would love to have an opportunity to help you with your real estate needs today. Learn more at www.thegold.group. Yeah, I mean that's got to be I would imagine the challenging part. How often are you running the models?
So the model is we finished up the second iteration, version 2.0, a couple weeks ago, and they are getting ready to do version 3.0 right now. So
all right. That'll be
it
is sort of it is fascinating to take a look at the information and see how to sort of how to parse it out and what it all means, because it is so because it changes so frequently. It is sort of it's interesting to see, and frankly, I think as somebody who's as a watcher of what's going on, what different states are doing, and who seems to have a handle on it and who seems maybe not to be direct.
Yeah.
I do feel like, as hard as this is, as hard as it is for, our kids who can't be in school with their friends or can't be, can't make plans and see people and all that, feel like this is the right way to approach it.
Yeah,
as difficult
absolutely.
as it is.
Yeah, I absolutely agree. It's nice to see data being part of the data and modeling being part of the consideration. For sure. So, yeah.
So what are you most looking forward to as we get back to hopefully normal sometime soon?
I think the thing got loud children. Sorry about that.
Maybe working without your children.
Maybe working without my children dancing behind me, which they just came to do. I'm recording a podcast right now, so it's super important that you are a little quiet. Yeah. I think I'm looking forward to just being able to see people. I'm generally an introvert, but it would be nice to be able to spend time with people who aren't my kids and husband. I think most
Sure.
people feel that way, being stuck with just one other, or in my case, three other people. Is that, I mean, it's hard.
Yeah,
I think it's
absolutely.
hard for everybody to just have a limited social circle. I think it's really hard for the kids.
Yeah.
They're used to seeing this group of people every day, and now they can't see them.
Dang it.
And I'm hoping you can edit that out.
Why? It's great.
Now he's doing Fortnite dances. I feel for them. They're stuck with, if they're lucky enough to have a sibling, then they're stuck with their sibling. If they don't have a sibling, then they don't have another kid in the house.
Right.
For adults who live alone, like that's hard, right?
Yeah, absolutely. And I will say, this is why I record. I'm sitting on the floor of my bedroom closet.
There you go. Yeah,
but still, it hasn't stopped my dog from trying to get into my room and scratching at the door before.
Right.
So I trust me, I understand. All right, well, last two questions, and I will let them get back to interrupting your day.
All right.
What is your favorite Jewish holiday?
My favorite Jewish holiday is Passover. It has been my favorite Jewish holiday for as long as I can remember. I really like the Seder. My grandfather always made it really fun, and it could tell. I mean, he put his own Haggadah together before that was the cool thing to do, and he just really got into the whole concept of freedom and the springtime, and just brought a lot of joy to the holiday. And my dad he does that as well. One of our favorite songs is, we have a song called Evil Ways, which is about the 10 plagues. It's a Santana parody that we do, which is pretty awesome. Maybe you'll get him on the podcast sometime to do Evil Ways. So Passover is by far my favorite Jewish holiday. And also, like, making popovers pretty much every day, and matzo meal pancakes. I mean, and gefilte fish, like, what, you can't go wrong.
No, not at all. That had to be really hard, though, this year, right?
It's interesting. On the one hand, it was hard to not have, not go to a Seder.
Right.
On the other hand, we got to have, like, my uncle who lives in New York was at our Seder this year. He wouldn't have otherwise been. My cousin moved to Nashville. He probably wouldn't have come home for the Seder, but he was there this year because we did it via Zoom. We got to have my husband's aunt and uncle from Los Angeles were at our second Seder. So there are some really good things about it. And the Zoom delay is hilarious. People are singing and everybody is like, wait, am I supposed to slow down? No, now we're off again. I mean, so it was, there are some funny parts, but I think the fact that you were able to celebrate the holiday with people who you may not otherwise regularly celebrate the holiday with is a pretty good thing. And I'm always trying to look for those silver linings. And
for sure, I do wonder. Do you think this is an opportunity maybe for Passover's future when we're back out in the wild to maybe bring people in, knowing how it worked this year, to bring in family from out of town who might not have otherwise been able to get back?
Yeah, I think it's a definite possibility. I just feel like one of the things that this has done is really kind of opened up our ability to share our holidays and our Judaism with other people. And that has, hopefully we'll figure out a way to continue that even when we get back to kind of our regular lives, when we have our, Shabbat dinners in person and go to synagogue in person. Hopefully we'll be able to maintain some of the good parts of the connections we were able to make during this time.
Absolutely. All right. Last question is, what is your favorite Jewish food?
Oh, man. It's like, do I go with like gefilte fish? I mean, it might be gefilte fish, to be honest. I'm a pretty big gefilte fish fan. But
that'd be a rather hot take. Oh, okay.
So
I say most people do not pick gefilte fish.
No, they probably don't.
Okay, so what's the secret to good gefilte fish? I'm not asking for like your
say,
secret
I
recipe or
would
anything.
say like,
but-
oh, I'd be happy to share the recipe. It just takes a lot of work.
Yeah.
I think it's, getting the pepper right, the amount of pepper in it. But I really, it's just having good fish and making it yourself and not having it be in a jar. My personal opinion, of course.
Yes, absolutely.
So like I've had homemade gefilte fish my whole life, and I've made it myself now. So I would say that's probably my favorite, like, Jewish food. Maybe blintzes is a close second. Cheese blintzes.
I love cheese
Those
blintzes.
are good.
Well, excellent. Well, Alisha Baines Simon, thank you so much for joining us this week. Thank you for the education on not only what you do, but clearly the important work that you're doing right now. I'm sure everybody's doing a little bit different job than they thought they would at MDH. So Thank you for joining us, and we appreciate it.
All right. Well, thank you so much for having me. This has been fun.
Thanks so much for listening, and thanks to Gold Group Realty for sponsoring this week. If you haven't yet, please subscribe, rate, and review the show. If you have someone who you think should be on the podcast, please email me at editor@tcjewfolk.com. The Who the Folk podcast is a product of Jewfolk Inc. and part of the Jewfolk Podcast Network. For more shows, check out tcjewfolk.com/podcast.